Here today with the candidate for Gosford, Liesl Tesch, outlining our support for the campaign for better nurse-patient ratios in our public hospitals.
Ratios is our big campaign at the moment, and so she's signed a commitment to support our ratio campaign, and so did David Harris, which was amazing for us.
Nurse-to-patient ratios in all specialties, keeping public hospitals public, and transparency and consultation with nurses and midwives. Absolutely.
Yes. We want to see this extended past just the wards that have them currently. We want to see it extended everywhere because the outcomes for our patients are better. The biggest complaint of patients is there's not enough nurses.
Liesl has committed to continue the fight against privatisation of health across New South Wales, not just the Central Coast.
Because she's obviously concerned about what the state government's doing with privatising our health system, and at the moment it's just Wyong on their radar, but we're quite concerned that there'll be other areas of the coast that will be attacked too.
I've spoken to different health workers who are going to be impacted by this privatisation across the whole sector. So it's not just nurses, it's the physios, it's the mental health and the patients that they're going to suffer as a result of what we don't even know.
We want the highest level of care in a public hospital. We don't want those services privatised.
I've had a number of elderly people extremely fearful about where they're going to go, what's going to happen to them. They're terrified.
There's no actual guarantees for any of us. So for me, getting into my 50s, getting towards the end of my career, having to actually rethink what I'm going to do in nursing is a bit of a big deal.
And I am here to say, let's stop the privatisation of Wyong Hospital, let's stop the privatisation. We need to get the message out that this impacts the whole of the Central Coast. This is and it impacts New South Wales and our health well-being for the long term.
And it's just big business making profits from patients.
The concern for us is when they privatise Wyong, as they say they're going to, that's going to push a lot of people down into our emergency, and we can see a lot of problems that will form from that.
Private hospitals tend to send people back to public when it gets a little difficult.
I for one don't want to work in a private system. I never have. I've been at Central Coast Health for 30 years. And I have no intention of moving across to a private system.
Keep public in public hands and not become America's poor cousin.
We believe that our community deserves better than that. We believe our patients deserve better than that.